Hello, my name is Autumn Hoffman. It's November 26, 2019. We're going to talk about the concepts we learned in Module 1. First, we're going to define disease. It is an internal or external stimulus that is causing your body to become sick and outside of its normal operating system. An example would be chronic obstructive pulmonary disease. Okay, this is affecting the lungs. Disease classification is defined as how we categorize the disease. Okay, we can do this multiple different ways. In physical therapy, we typically do it systemically, where it is cardiovascular, pulmonary, neuromuscular, musculoskeletal, or the nervous system. Okay. We can also do infectious disease versus non-infectious disease. So bottom line is, it's how we group diseases together. So for example, COPD, we could group as a non-infectious disease and affecting the pulmonary system. Okay. Etiology is what causes the disease. Okay. How did this disease occur? Okay. The number one etiology or cause for COPD is smoking. Okay. Pathogenesis tells us how the disease begins. Okay, because Genesis means beginning, right? Okay. So the beginning process of COPD is when you are smoking, you're inhaling that smoke. It's causing irritation in your bronchial tubes in your lungs and setting off an inflammatory process. Okay. This gets the ball rolling and starts progressing towards COPD signs and symptoms. Okay. A symptom is what we define as what the patient tells you. Okay. You can't see it or measure it typically. So, for example, fatigue would be a good symptom. We can't really state how much they're fatigued or what's going on. It's something they're perceiving in their body. A sign is something you can see or measure. Okay. So for example, muscle weakness. You can use manual muscle testing, a diometer, or girth measurements if there's atrophy involved to test the muscle strength with that. Next, we'll go on to the diagnostic testing. Okay. The diagnostic testing is what I like to call the data we collect from physical examinations, patient's history, imaging, procedures. We take all of this data and it helps us try to make sure that we are on the right track. And it helps determine if we have the correct diagnosis or if there's some differential diagnoses that we need to consider. A diagnosis then would be the label. Okay, you're going to take all these signs and symptoms, you're going to take your diagnostic testing data, and you're going to put a label on what this patient has. So for example, with our COPD patient, this is a disease process, and there's actually several different diagnoses that are associated with this disease, and so the diagnosis could be emphysema based on the patient's signs and symptoms and their history and testing. Syndrome is what we define as signs and symptoms that have a unique pattern and are associated with a very specific disease process. So for example, overuse syndrome we see with repetitive activity, pain, swelling, and muscle imbalance. Those are the four signs and symptoms that we see with this syndrome. When we can see this with postural dysfunction, with bicipital tendinitis, golfer's elbow or tennis elbow. There's different things that are overused but have these same signs and symptoms. Complications are the negative things that happen. Okay, something goes wrong. That is your complication. For example, a DVT. It's is caused from you laying in bed or not moving your muscles because it takes away the musculovenous pump in your calves and it allows blood to kind of pool there and form a clot. Okay, that would be a complication. A prognosis is the outcome or the result. Okay? We can have good, fair, poor prognosis, or we can give a prognosis in percentage form. So with our COPD patient, let's say we have severe COPD, that they might have a poor prognosis, especially when it comes to quality of life. Okay. So those are the definitions and stuff we covered last week. Thank you.